I only do anesthesia, I don't know anything, but like narrow esophagus, that's a symptom of something. That's
You're not my doctor, what?
If you have like a stricture in your esophagus, all you do is chew your food more. If you really have a problem, you go get treatment for that. You don't eat food, and then your reason for not eating food is because you're like, I have a narrow esophagus.
Why am I having a doctor's appointment right now?
You're not having a doctor's appointment.
Do you need my health insurance card? Shall we go get my esophagus stretched all together as a group?
Oh my God.
Her doctor said she could drink and have gabapentin at the same time.
Well, she did.
Well, you can't.
Are you my doctor?
It doesn't matter. I am a board-certified nurse.
Is mayonnaise an instrument?
No, Patrick, mayonnaise is not an instrument. Horseradish is not an instrument either.
Sutton, her small esophagus. There is a medical reason why this is going on.
I want to understand.
I'm done. But small esophagus is not the reason. You can say that to a lay person.
Oh, Lord. Again. Again. Nothing new, nothing changed, same old shit. Same old fucking shit.
Okay, so a bunch of you guys tagged me in this clip of Annemarie talking to Sutton about her esophagus, and I finally had time to watch the episode, so now I'm gonna weigh in. I think it was very disturbing how Annemarie was like weaponizing her medical profession to tell Sutton things about her own condition. I'm gonna digress a little bit here and just talk about the esophagus. So the esophagus exists for one reason, which is to get food from your mouth into your stomach. It's just like a long, narrow tube. Sometimes the esophagus can have a stricture, which is a narrowing, and it can be severe or it can be mild. The first symptom that patients usually present with is difficulty swallowing. So you don't just chew your food more. Like, a stricture is a stricture, and you can chew your food all you want, but unless you blend it into a smoothie, if your stricture is narrow, you're gonna have like the feeling of some food stuck in your esophagus. The most common cause is GERD, which is reflux disease, very common, peptic ulcer disease, cancer, eosinophilic esophagitis. Now, I specialize in thoracic anesthesia, so I'm very, very familiar with the procedures that we use to dilate the narrowing. It's basically, we put a scope down the patient's mouth and go into the esophagus and locate where the stricture is. And then using a bougie, a balloon, or a guided wire, we are able to tent open the stricture a little bit more. I have done hundreds of these surgeries, and it's a minor procedure. You do have to undergo general anesthesia for it most of the time. The whole scene was kind of cringy to me. I don't know what made her go at Sutton so hard, especially when it was her party. Like, I found that to be incredibly rude. But yeah, let's not weaponize our medical knowledge to come at people, especially when you're wrong.
Not going to bore you with the medical details. Tiffany Moon did a great post, so if you want to go check that out, go for it. But here's my personal opinion on this. This is not a question about whether you are a nurse, a CRNA versus a physician. It does not matter where you fall in the spectrum, all the way from being a tech to being a doctor. You join the profession to be an advocate for patients. And as such, it is not our place to belittle, question, or demean a patient's symptoms or diagnosis. We are there to facilitate and help the patient through the medical process. And it was just very uncomfortable and cringy to watch Annemarie belittle Sutton's symptoms in such a way. She's a lovely person, Annemarie. I met her at BravoCon. We sat on the panel, but that scene was a no.
Yeah, so I was really very hurt by Dr. Nicole doing that. You know, as a colleague in anesthesia practice, she knows my training, she knows my skill set, she knows my knowledge base. And so I would think that, you know, if you see something and you're kind of wondering, like, why are you going along that line of questioning? Why wouldn't you offer that professional courtesy and reach out to me and kind of ask and say, oh, I wasn't really comfortable with that. Like, why were you doing that? And then as another, you know, reality TV personality, she knows that, you know, you don't always get the full picture. And so I feel like for both of those reasons, it would have made, if she actually was responding because she really cared, she would have reached out to me. And I actually did reach out to her after I was told that she made a video, and, you know, she didn't respond to it, which, you know, shows me that this wasn't so much about clarifying anything for anyone. It was really, unfortunately, about trying to capitalize off of the Beverly Hills show. And, I guess this is what the kids call clout chasing, right?
To chase clout implies that you're going after a bigger fish, and Annemarie is in no way a bigger fish, not professionally, not medically, not educationally. So I don't think I was chasing any clout.
A few moments later.
Are we good,
Totally.
doctor?
Yes.
Okay.
That was so condescending, no?